Hello and welcome to this brief benefit training. Today I will be covering the differences between HMO, PPO, and point of service, along with providing just a little bit more insight into what you may see on a plan summary provided by your worksite employer when you are either a brand new hire, during open enrollment, or during a qualified life event. The information I'll be covering today is just general information. The plan summary that you're seeing on my screen currently is actually just a general plan summary and does not reflect exactly what you may be offered by your worksite employer. Each company is going to be different in the plans they offer, but this is just a generalized plan summary to allow you to see the differences between plans and hopefully provide a little bit more clarification. After this training, if you do have any additional questions or would like additional assistance, please feel free to call our main office at 702-598-0000 and we would be happy to assist. So to start off, of course, just to give a little bit of back history on where you'll be looking for this information, when you go online to your employee self-service portal, so this is advanstaff.com, you'd click employee and then employee portal. That will bring you to this login screen here where you'll be seeing the ability to put in your username and password. It's the same portal that you actually utilize to go in and find your check stubs, W-2, all of that information. It's the exact same portal. Mine's taking just a little bit of time to load, but just to give you a little bit of a visual here, I'm using a demo employee that's actually logged in on the Advanstaff portal. This is the dashboard, so you may be more familiarized with this once you do see it. When you go to the left-hand side of navigation over here and go to benefits and then benefits enrollment, that's where you would be going to enroll in any type of plans or select any type of plan options, view what's available to you during the periods that you are available to enroll in them. Please do keep in mind that this is not an all year round time. It's actually typically only once a year for each of our companies, and that information should be specific to your company. So of course, if you'd like to know those open enrollment timeframes, again, we're happy to answer those questions, but that's just a little bit of information about where you'd be getting that information along with where you'd be selecting the plans themselves. So benefits enrollment under the benefits category is where you would go, and it'll actually open up into a new window for you. If I do click on that, it will open up a new window for me, just as if it would for you. But as you may see, if you're not during your open enrollment period, it's going to tell me that I do not have a current workflow available for me to be able to enroll in. Reason for that, of course, is that it's not open enrollment for this demo employee. We do not have them enrolled in any type of open enrollment timeframe, so they won't see it load here, but it will open up into a new tab for you, and you may receive an alert like this. Service provider would, of course, be us at Advanstaff, and we can look into that more in more detail for you if you do believe that you should be in that open enrollment timeframe. Please also make sure that you have that pop-up blocker off on your web browser. That's something that's very crucial about open enrollment. It does open into a new tab or a new window, depending on the browser that you use. So those are just some quick tips for you in how exactly to find the benefit enrollment itself. All right, so to go forward with the plan summary, the bulk of this training that we'll be going over today, I just want to cover briefly the differences between HMO, PPO, and point of service. These are the plans that are available all across all of our companies, but not every single one of them, again, will be available to you when you go to enroll. As you can see underneath each of the plans, there are not any rates for the cost of the per paycheck rate. That is on purpose, of course, because those rates do fluctuate each year and yours may be different from another company. So we just want to make sure that there's no confusion there. But the differences between HMO, PPO, and point of service. If you have never had a plan, benefits in general, or you've never really explored the details about your plan, hopefully this will help you understand exactly what is available to you. So right over here, we have HMO Bronze, Silver, and Gold. These three plans are in what's called an HMO tier. HMO being a policy that is more referral based. So that being said, within an HMO network, let's say you enrolled in the HMO Bronze plan, if you wanted to go see a specialist, you would need a referral from your primary care provider in order to go see that specialist. A specialist would be anyone who specializes in a specific field. So a chiropractor, foot doctor, dermatologist, anyone that may go into a specialized field, you'll need a referral from your primary care provider. Many employees that we do speak with have had an HMO policy in the past or are familiar with them, so that may provide you a little bit of base work to know exactly what these plans are over here. Skipping over to the PPO plans right here, we have a PPO 500, out of area 500, and out of area 1000. You may not see these two plans over here at all if you are an employee that is within the Las Vegas area, because out of area, of course, does not apply to you. So the highest you may see is the PPO 500 plan. PPO, unlike HMO, does not require a referral. So the difference with that plan is that as long as you're going to a doctor that is in network or accepts the coverage that you are enrolling in, then you don't need a referral to go see that specialist. You can make an appointment with them directly, and there's no need to go to your primary care provider first in most cases to go see that specialist. Of course, if you need recommendations from your primary care provider or anything like that, that's of course something that should be arranged. But in general, if you needed to go see those specialists in the PPO realm, you do not need to go to your primary care physician first. So that's the main difference between the two bulks of the plans there. These two plans in the middle that I did skip over, I did that on purpose just because now that we've laid the groundwork for what HMO is and what PPO is, now you can understand what point of service or POS actually is. There's two different plans available for you here that you can see. Again, both of which may not be available on your plan summary, but to cover briefly, a point of service plan is actually a dual plan. So you have HMO and PPO coverage on these two plans. These two are some of the favorite plans we like to offer employees, just simply because they do have quite a few flexibility options for those of you that are a little bit more familiar with what the functionality of each plan is. And maybe you really do enjoy the medical side of things and you like to make sure that you're utilizing your coverage to the fullest extent. These two plans may work really well for you. The great thing about the HMO and the PPO being on both sides here, as you can see, these rates on the left-hand side are going to all be HMO, and these rates on the right-hand side are all going to be PPO. The great thing about that is that you can utilize both coverages. So if you wanted to go to a doctor within an HMO network, but you wanted to be able to utilize PPO for other things, you can under these two plans. They really do allow you quite a bit of flexibility. The other plans are great. They provide great coverage, of course, depending on your need, but the point of service plans really are great for that flexibility option, as I mentioned before. Just to go over briefly as well, these details here on the left-hand side of the plan summary that you may be looking at and wondering why do those correspond with these numbers across. These numbers here, like under the HMO Bronze, for example, these numbers here all correspond with these rows over here. So just to give you a little bit of an look into what that exactly means. Right here we have calendar deductible and out-of-pocket max. These are going to be two different things that allow you to see exactly what the coverage does for you as the employee that is covered under that plan. So let's go to the HMO Gold plan for an example. The calendar year deductible on this plan means, the way I like to explain it to many employees, is that is the threshold that you have to reach before your insurance starts paying for any of your services. So contributing towards your healthcare basically. So your deductible is that first threshold that you have to meet, and then following that threshold, your insurance will start paying 80% of the bill while you pay 20%. And then the next threshold after that is that out-of-pocket max, where that's the absolute maximum that you would pay in that entire year. And then that would be the absolute cap of what you would be paying. So you know that under that insurance, there's a cap of how much you can be charged for with the services that are listed. So that's something that's a great thing. Without insurance, of course, you can be charged as much as the hospital may charge you or what have you. There's all sorts of variables that go into that. But having health insurance, of course, is something that we always recommend. And it's something that can work really well for you with that protection of knowing that there's a cap on how much you would pay. An important thing to note as well are these copays listed down below. These are going to all correspond with the copays for each individual plan. So a specialist copay on the HMO Bronze plan would be $40, whereas on the HMO Gold plan, it would be $30 for that specialist copay. Hopefully you can see those differences there and maybe be able to understand the difference between each of the plans. Some of the changes may be slight, like the primary care provider copay is only a $5 difference between the silver and the gold, but $5 is $5, we always like to say. So you being able to see these differences and choose which one works the best for you is very crucial in making sure that you decide not only what plan works for you medically, but also financially. We want to make sure that those two things work well together. Something we also like to note on these plans is that there's an urgent care copay. Please utilize urgent care before going to the emergency room in the ways that you can anyway. Of course, there are certain circumstances where you should absolutely go to the emergency room. There, spinal injuries, very serious conditions, you should absolutely utilize that coverage. But with the urgent care copay, if you are feeling like you have a fever and you need to go see a doctor right away, those copays are going to be significantly less than the copays that you're going to be seeing at the emergency room visit. Let's look at the HMO Bronze just as an example for that baseline coverage. This is typically the lowest level coverage plan we offer. It works great for certain employees. Again, works well for you medically and financially if that's what you'd like to enroll in, but we do have other plans available to you, of course. Let's just utilize though that for an example. So we have the urgent care copay listed at $35 under the HMO Bronze plan. So if you went to the urgent care, that would cost you $35 for that copay. Instead of going to urgent care, let's say you went to the emergency room and you decided to utilize that service, you're looking at your calendar deductible, which is CYD. So that acronym CYD being calendar year deductible there. So that would be under the HMO Bronze plan, $3,000 right there, right? So input the $3,000 where that CYD stands plus 1,000. So you're looking at quite a bit of cost there difference between the two different office visits you'd be looking at. So that's just an example of why it's important. Even under the HMO Gold plan, you're looking at an urgent care copay of $30 versus $500. That's something that's really crucial to understand, that the plans themselves work well for you when you utilize them correctly. Hopefully that's something that we can, of course, assist you with if you do have any further questions about it. But I just wanted to briefly touch on the fact that the copays listed here are all going to be corresponding to each of the plans individually. Something really unique about the point of service plan, for an example, is that they do have different copays listed. So you can utilize either one of the coverages if they work better for you. Quite a bit of the time you will see that the costs are exactly the same or very similar, but there are times where there is a difference, of course. So that's something that you could maybe customize and utilize in a different way. Now, we have the prescriptions for those copays listed at the bottom of each of these. That's going to be something that you'd want to look at in detail, of course, if you do have any type of prescriptions. Something that is very essential in understanding is we have generic, preferred, and non-preferred. Generic being the baseline coverage for the actual copay itself. So that would be something, if you go to the doctor, you can request a generic version of a certain drug if you'd like. Then we have preferred, which is a step up from that. And then we have non-preferred, which is what we like to call designer. So something that you may see on TV as an ad or something like that. That would be in the highest level coverage for the copays listed there. Again, if you have specific concerns about costs or anything, we can help you with that breakdown. But just to go over very briefly, quite a few individuals always do have questions about that prescription copay. So that was just to touch on that briefly. Something I'd like to touch on as well is that the per EE, as you can see here, or per employee, are going to be different for each individual depending on the utilization of coverage you'd like to enroll in. So we have employee only or family. There's going to be a difference, of course, per cost of you just enrolling certain individuals onto your plan, but family would consider your spouse, domestic partner, or and then your children, of course. So those can be adopted, natural born, all those types of situations. But as long as there's documentation to support that, then that would be considered family enrollment. So that's going to be, again, there's different levels of enrollment that you can enroll in: employee only, employee plus child or children, and then employee plus spouse, and then employee plus family. They have to meet those criteria of being, spouse being your actual spouse or domestic partner. Of course, we can't enroll girlfriend, boyfriend, anything like that. And then children need to be natural born, adopted. Certain criteria do need to be met for that. But you can actually select what tier of coverage you'd like to enroll in. Those will be more available to you, again, with those specific rates for the plans that are offered by your worksite employer. So you won't be seeing them here today, but that's just something to note as well. You can absolutely customize the coverage on the level of coverage you'd like to have as well. All right, so the last thing I wanted to cover today is the differences between the dental and the vision plans here at the bottom. These plans, again, they may or may not be available to you when you go to enroll in those benefits, but I do want to cover just very briefly the differences between the plans that are available. These are typically going to be in a different carrier. So like I was mentioning earlier, we have HMO through Health Plan of Nevada. PPO is through Sierra Health and Life, and then the point of service plan is of course through both, and those are overarching under the umbrella of United Healthcare. So that's something to note. These plans though are specific. So Health Plan of Nevada, Sierra Health and Life for the medical up at the top. Dental and vision are typically through a carrier called MetLife, currently as of 2019. Those plans are going to be separate from your medical, so that's something to note as well. They're a paperless company. They won't send you out any cards like how you would receive with your medical. The dental and the vision actually just bill through social, date of birth. Those details are enough to pull you up in the system if they do accept that coverage at whatever facility you're visiting. So with the dental plan options, they are PPO, and same with the vision. They are considered PPO networks. So of course you don't need a referral to go see them, which is great. And we have different types. So we have type A, type B, and type C, different coverages there, as well as deductible listed for individual or family. And those are going to be different, of course. And then child ortho, if that's something that's offered by your employer in the plan that they've selected, that will be listed there as well. And then, of course, for vision, we do have the this based on a 12-month frequency. So you can't go to the optometrist more than once a year and still receive these same copays. But if you just go once a year, these will be the copays you'll be experiencing under this policy that's offered. And then you do get $150 towards frames or contacts, and that's per that 12-month period. Alrighty, so to just cover briefly once again, all of these details are going to be dependent on what your employer offers, what is available to them, and what they would like to offer you as the employee. So you may not see certain plans available to you. That does not mean that you cannot find a plan that works well for you. There are all sorts of different options available to you. We'd be happy to assist you here in office with any questions that you may have in regards to the differences between HMO, PPO, point of service, explain it in more detail, maybe help you along, see what plan is available and what one works best for you when that time does come for your open enrollment. But of course, we always encourage you to utilize, again, that the enrollment online once it is available for you, of course. We do recommend that you go on there and maybe compare those policies. That's something that's really great, actually, is the ability to go on and compare the policies themselves, look at the different copays, see exactly what would work best for you. We just want you to know, of course, the basics of the plans that are offered and maybe help you understand the plan summary itself, but we'd be happy to consult with you. Again, our hours are 8:30 to 5, Monday through Friday, and all of our details will be available for you as well on our website. So on that advanstaff.com center, you'll be able to find all of our details as well. So we have our phone number listed here at the top, as well as our contact hours, and we do, of course, also have the ability to contact us at, or create a support ticket through the Help Center. So please feel free to reach out to us in any of the mediums that are available to you. We definitely hope that this training today was at least informational for you, provided a little bit more detail, and helped you really understand how to read the plan summaries and maybe choose the plan that works well for you. Thank you so much for spending the time with us today. Of course, again, if you have any questions, please reach out to us. We are happy to assist you. Best of luck in your open enrollment, and we hope everything works out well. Thank you so much again. Have a great day.